here to dispel some of the myths and answer 4 important questions that we get asked a lot. I am with Dr. Angela Sturm. She is a prominent facial plastic surgeon in Houston. And me, Christiane Waldron, I'm the owner of Genetica Skincare. So before we go on to asking all these questions, I'd like to talk to you about us a little bit so you know where we are and who we are and where we come from. So first and foremost, Dr. Sturm, please tell me about yourself a little bit, how you got to be here. We're in her practice, so let's talk a little bit about this wonderful location we're in.
I am from a small town in West Texas. First one in my family to be a physician. My dad's a farmer. So got out of the small town, came to Houston.
Wow.
I'm an Aggie, went to A&M for undergrad and came to Houston for Baylor for medical school and for my training. Fell in love with facial plastics when I saw them make a ear for a child out of a rib. Thought that was the best day you could possibly have, is to create an ear. So I just fell in love with the creativity and the positivity and the way that we can impact people's lives.
That's awesome. How long have you been a plastic surgeon?
About 4 years.
Okay, and what is your favorite operation?
Rhinoplasty.
Rhinoplasty, okay. Yeah, we all need to look pretty, right? And about me now, I am Christiane Waldron. I'm a scientist. I'm a chemical engineer, actually. I graduated going on 20 years now. It's been a while. And about 4 years ago, I was in the biopharmaceutical industry for a long time. I made vitamins. My specialty really was taking small recipes and bringing them to the commercial scale. And I don't know, something got to me, and then I decided I wanted to start my own skincare company. My philosophy is very simple. I worry about, we have an anti-aging skincare line. So I worry about aging. I try to incorporate a lot of really food for skin. So I try to feed your skin from the outside in, and then you try to help us also from the outside and from the inside. Acne, that's a big one. I was reading a recent study earlier this year, and part of the problem right now is the recent studies have found out that as much as 40% of adult women have now acne. And most of those have never had acne when they were children or teenagers. So, they were making the assumption of the leaky gut syndrome, that whatever, who you are, who you eat, unfortunately. And so if especially for North Americans, we tend to destroy the flora in our stomachs, and we tend to eat really fatty foods and things that are really not good for us, and we don't get in the micronutrients. So there's a lot of things about juicing now that they're saying gives you micronutrients, etc. So for me, anyway, for acne, I tend to get asked the question a lot. And there's a myth I would love to dispel, because women ask me all the time, and some of them, all of a sudden, they're in their 30s, and all of a sudden they get the acne. Some of it is hormonal,
right?
But when you go to the pharmacy, you tend to see a lot of products that are very harsh for the skin, and I think some women tend to really strip their skin naked.
Yeah.
And so what ends up happening, acne is the proliferation of the bacteria called P. acnes, and we have it in our bodies. And so you have to control it. Now, the studies show that some people tend to have a reaction to P. acnes more than others, and those are the ones that tend to develop acne. And then with the oil that you have on your skin is the food for the acne, so the bacteria really loves that oil. And so you'll have the mild acne, which sometimes I get. You'll have the moderate acne, which is going to be the pimple, and then with the white spot, and then you'll have the severe cystic acne. And I always tell my clients, treat acne like you would sensitive skin. Cleansers are important because they keep your skin clean. Use a cleanser that's mild, not a cleanser that's harsh. If you feel like your skin is tight after you've done the cleansing, and if you have acne, probably it's not the right cleanser for you. Also, buy products that don't tend to promote oil. I don't think that having oil in a product is going to hurt. A lot of people say, oh, no, don't buy oil-free. I don't believe in that. But it's a trial and error. If the acne is really severe, I would go to my doctor. What do you think?
Yeah, for severe acne, a lot of the topical things may help some, but it may not, you know, do the whole job. And there's things that you can do as far as take antibiotics, and there's always Accutane, which is a great drug, works very well, but you want to make sure you've done everything else before that, and you're working with a doctor that's monitoring you and, asking the right questions, because it can have a lot of side effects.
It is kind of a last resort.
So try everything and then...
So treat acneic skin like gentle skin. Don't overstrip it. Don't remove the oil, and then make sure you get good products. Sometimes I really believe in you get what you pay for, and sometimes better products are going to be a little bit more expensive, but they're well worth it to keep your skin clear. Consult with people as well. Go to see your doctor, and then try things that are, have good reputation, and see what happens. What about, is there, some women also who have suffered from acne as they were young have the scarring as adults. Is there anything you can do there?
And that's a lot of times where I'll see them is, once we get the acne under control, I'll work with a dermatologist, and then they'll see me for the acne scarring. And any kind of resurfacing does help, but you do have to be a little more aggressive with your resurfacing, because it's not just the scar on the surface, but it actually makes the dermis thinner at that level. And so you have to, like I said, be a little more aggressive in getting your collagen stimulation deep.
So an ablative laser, what is the, how many times do you have to do that?
If you do a fully ablative laser, it should just be one time.
Really? And then it would resurface the skin?
It's really
fantastic.
Really pretty, actually.
Does that hurt?
It really doesn't. You're red and you're sticky, just because it's like when you scrape your skin and it's that red sticky for about
like
2
a baby
weeks.
Skin.
That baby skin where it's growing in, but it doesn't hurt. It's sticky.
Okay. And then so the downtime for that is about 2 weeks?
About 2 weeks.
Can you go out during those 2 weeks, or you're going to be red and look awful?
You're probably not going to want to go a whole lot of places, and you just want to be careful about where you're going also, because you wouldn't want to have any sort of infection or be around anyone that could potentially...
Do you give antibiotics that are topical as well?
We do antibiotic ointment, and then we also do oral antibiotics, antifungals, antivirals, cover you for everything.
Okay, that's good. And then I think once you've healed from a skincare standpoint, I really, vitamin C is the gold standard as well for keeping that exfoliated and healthy skin. And I would also incorporate something that has an exfoliant. So I would do a glycolic, mild peel on occasion to just keep the exfoliation on your face. So you want to keep that smooth skin as well. So I really, really love mild glycolic peels that'll, give you that little boost that you just got from the laser, but that'll continue to work forever.
Yeah, keep that maintenance.
Do you recommend scrubs on post, ablative, after you've healed, or more of a peel?
A peel's going to be a little bit better, get you a little more exfoliation.
Yeah.
But of course you want to wait.
You want to wait
until your doctor says it's okay.
Yes, absolutely. Anything you do, you want to wait for that as well. If you want to talk to any of us, we're going to have our email in the bottom. This is Dr. Sturm. She's a Houston facial plastic surgeon, and I'm Christiane Waldron, the founder of Genetica Skincare. Please watch our other videos that are going to be coming up very shortly, and thank you for watching.